is definitely one of the number one causes of cancer in someone's body. And that's why it's imperative that we have the right people around us. It's imperative that we take care of ourselves, that we try to maintain a healthy lifestyle, create balance. Hey, young world. Happy Wednesday. Look, y'all, we haven't had a girl talk in, I want to say, maybe a month. So, on today, I just wanted to get with you guys and talk about something that is actually monumental for me. So, which is cool for me. And I'll start off by saying that some of you may be aware of this, but I know I have new subscribers, so some of you may not be aware of this. Additionally, some of you may or may not notice that I've removed some vlogs from my channel because I had red checks on them, and since they had red checks on them, they really weren't doing me any purpose or anything like that. So this may be some repetitive information. It may not be repetitive to some of you. So anyway, this week is actually an anniversary for me. Huge anniversary, honey. Huge anniversary. My lips have been dry. I don't know why, but they have been. So this time in 2019, actually May 24th of 2019, I was finishing up 30 sessions of radiation therapy. So this will make 5 years of being breast cancer free for me. In February 19th of 2019, I was diagnosed with invasive ductal carcinoma, stage 2 breast cancer on my left breast, on my left side. So when I was diagnosed, the process was extremely quick for me. I mean, the group of my medical team, let me just say it that way, my medical team was absolutely amazing. I think this is why it's important I think this is why it's important that if you can afford insurance, you should have insurance somehow, some way, because like I said, my symptoms started in 2018. Actually, when I first noticed my symptoms, I didn't think it was associated with breast cancer because the symptoms were coming up in the lower part of my leg. I didn't know it was breast cancer until I went to my PCP the latter part of 2018, who then pushed me over to my surgeon to talk about options to either get a mastectomy or flebectomy. I think I'm saying that right, which means either to remove my breast completely or to remove the tumor. And my choice was to remove the tumor and preserve my breast because I didn't want to go through getting any, I didn't want fake boobs. I wanted my boobs. Just put it simple as that. So I chose to preserve my breast. So up under this arm, I have like a permanent scar. And across this left breast, I have a permanent scar. It's called a lymphectomy. There you go. Up under here, they had to remove some of my lymph nodes. And across my breast, they had to go in and actually remove the tissue in the tumor out. So I said tissue and tumor because they removed the tumor, and if there's any tissue around it, you guys have to understand that since a tumor is like a disease, it can infect the tissue around it. That's how it grows, right? So they had to remove that. All the cells around where the tumor was were removed to ensure that the breast cancer would not come back. If that's easy enough. So for me, I got to meet my surgeon, who was a great guy, and I'm a huge stickler about women doctors versus male doctors. I prefer to have women doctors around me than males, but the guy who was my surgeon for my breast cancer has been around for many, many years. Hopefully he's still around today, but he was strongly recommended. And then my medical oncologist, who saw over me through the whole entire, who's still seeing over me today. I'll have to see my medical oncologist for the rest of my life. She watches over me to make sure that the breast cancer don't come back, make sure my blood is drawn, make sure that, you know, if I'm having any side effects, whatever the case may be, she's the one who will notify whomever, whenever. And then my radiation oncologist, my radiation therapist, is the person who oversaw all of my radiation therapy. So I had 4 people on my team who was very active in my life, more so the first 3 years after diagnosis. After the 3rd year, radiation kind of like dropped off, as well as my surgeon dropped off. But my PCP, as well as my medical oncologist, they're always going to be there. So, diagnosed February of 2019, had surgery the beginning of March, went into recovery, started therapy, radiation therapy, April, ended end of May. So what you may have noticed is that I didn't mention chemo, which a lot of people do have to take chemo when they're diagnosed with any type of cancer, breast cancer, or whatever. I didn't have to take chemo, probably because I was only stage 2. But I did have to take a chemo replacement, which is called tamoxifen, and they're medications that you would typically have to take. For me, I was diagnosed to where I had to take it for 10 years. So today I'm still taking tamoxifen. Every day, every morning when I wake up, it's little white pills. Hey, I'm sorry about that. Okay, I'm sorry about that, you guys. I had a meeting to jump on, and I actually have another meeting in about 15 minutes that I need to get on to. So I just wanted to provide some clarity. I originally stated that my PCP, primary care practitioner, notified my surgeon. There's a step that I missed off in there. So when I went to my primary care practitioner, and she identified that, yes, there's a chance that I have breast cancer, she sent me over to Austin Radiology Association, ARA. Austin Radiology Association then confirmed that, yes, it was breast cancer. So what did that look like? Here's the thing. And very important to know. Most women of color have dense breast tissue. So this means that for women that does not have melanin in them, this is not likely an issue for them. But for women who have melanin in them, this is an issue for them. They have very dense breast tissue, which is somewhat of a risk, because it's very hard to identify the cancer when it's inside of you, when you have dense breast tissue. So when I first went to ARA, ARA did a regular mammogram on me, and they did the mammogram, and since the notion was that I had breast cancer, typically when you go to ARA, they'll do the mammogram and then they'll send you a letter later to confirm whether you're good or not. They don't typically do it on the spot unless a medical professional refers you and says, yes, there's something definitely wrong. So run the test and then confirm in that moment, pretty much, right? So when they did the initial mammogram on me, they came back and they said, well, they didn't see anything. And I was like, no. I can touch myself and feel it, right? I can feel that there's something off in there. So you guys gonna have to either run another test or get another doctor or do something. And I just wanted to point that out because a lot of times when we go off into medical facilities as patients and we don't agree with the diagnosis, we just take we don't agree with the diagnosis. We don't fight for our rights of saying, no, there's something there, or we want more tests. We just kind of accept what's given to us. And at this day and age, we don't need to just accept what's given to us because there's too much going on out there for us to just be complacent about someone giving you a diagnosis, right? So I told them, and since the regular mammogram didn't work, the only way that they could identify my breast cancer was doing a sonogram. And I mentioned this in the last vlog, in a prior vlog. The sonogram is the same thing as it would be if you were checking on a fetus inside of someone's belly, right? Especially at a very young age, or a very youthful pregnancy. Like you want to see the egg, you want to hear the heartbeat, you want to do all this kind of stuff. They had to take me into one of those rooms to find the lump in my breast because my tissue was so thick. The density of my breast tissue is so thick. They were then able to identify that, yes, she definitely has a tumor in her breast and it's definitely needs to be removed. So after they confirmed, they notified my PCP, who then notified my surgeon. And then all the rest of what happened in the first clip. But what I also want to say here is that as we age in life and we run into medical conditions or issues, clinical professionals, one, they measure age with necessity, right? Are you at the age or are you at the health where doing a certain surgery or providing a certain medications or whatever the case, does that make sense at the time, right? They do that a lot. But what I want to encourage you all about is that you're responsible for your own health. So you don't have to just sit and accept what a medical professional says. If you want to go through something or you really feel like something is going on, make sure you speak up for yourself, right? Additionally, make sure you hear all your options, right? And choose the best option for you when it comes to how they want to resolve the problem, right? I had the option of, again, having to get a mastectomy versus not, a full mastectomy versus not, and you know, the boobies are still kind of hanging off in there. But that's any medical scenario. There's always options out there. There's nothing that's cut and dry anymore. Nothing. That's the point I'm trying to get across. There's nothing when it comes to medical services that is completely cut and dry, because technology has evolved when it comes to clinical services and all that kind of stuff. So likely when you're diagnosed with something, you should have at least 2 or 3 options to go by. Even when it comes down to them providing pamphlets and all that good stuff for you to be able to look into it more, that should be available to you, right? So I just wanted to share that and provide that clarity before I moved on to what the expense and financial piece burdens look like when it came to me and cancer. I kind of mentioned having insurance being very important. And here's why. I wanted to try to clear up some of the myths about what out-of-pockets may look like versus what they don't look like. So for me, because I have insurance through my company, all I've had to pay thus far over 5 years is co-pays. When I went into surgery, I had to pay a $2,000 deductible based off of my insurance. But every visit after that, to include my mammogram visits, I've only had to pay co-pays. What does my copay look like? $50 a visit. Health insurance is very important. Without that health insurance, yeah, you'll likely have to pay out of pocket, but the savings is significant. Even with the tamoxifen that I have to take daily, my health insurance covers the tamoxifen 100%. I haven't had to pay not 1 red cent for my medication at all. So coming up in June, I have my annual mammogram, and then coming up in September, I go back to see my medical oncologist. So kind of just to give you an idea of like the visits just in general. The first year, I was seeing my medical oncologist, my radiation therapist, my surgeon, my PCP, and the mammogram people quarterly. After the first year, I was seeing them every 6 months, all of them. After the 3rd year, I start seeing them yearly, right? So you do the math associated with, your copays, $50. So if I'm seeing all 5 every quarter, that's $250 a quarter. Am I doing the math right? Which would end up as being about $900 a year. Am I doing that right? Let's see. Child, I don't know why I'm trying to add in my head when. So $50 copay times 5. Yeah, $250 times 4. Yeah, times 4 to be about $1,000. between $750 and $1,000. And the reason why I say that is because when you think about quarters, your first quarter at the beginning of the year, oftentimes you kind of get through that quarter and they'll hit you on the second, third, and fourth. So that's how that worked. So then within 2 years, I'm paying less than a percentage of that because I'm only going every 6 months. So again, you can take that $50 every 6 months and multiply it times 2, and it drops it down to maybe $400 a year. So with insurance, it's not as expensive. Those numbers may seem like a lot, but if you didn't have insurance, imagine having to pay the entire bill. It's crazy. So now that I'm seeing just my medical oncologist and I have to get my regular mammograms once a year, that's what, $100 a year when it comes to co-pays for my breast. All the rest of it, the insurance covers. So, honestly, and I can't stress it enough, and it may be because of my profession. You guys know, some of you may know that I've been in healthcare for over 30 years. The majority of my life has been through that administrative end of it. The last decade of my life, it has been insurance. So that's why I'm sharing this information. Lastly, the plus is that when I want to say when I was within my 3rd year of treatment, my oncologist team reached out and they said, hey, we'd like to do more tests on your tumor to see, if you actually have to take the tamoxifen for the entire decade, which came as to a surprise for me, because I'm thinking once they took my tissue and my tumor out, things just kind of like went, I don't know, I thought they threw it away, but they didn't. They didn't. I don't know why I thought that. I didn't, but they didn't. So, here's what I found out. When they remove your tumor, right, they house it. They send it to whatever clinical technology cancer site. They freeze it, they house it. So if they want to do any additional tests on you, they don't have to go back off in you because the cancer is no longer there. So a few tests that they ran on me, they wanted to see if this is a malignant thing, like if this is something that it's called BRCA2, because they wanted to see if, since I got breast cancer, is this something that my children will be, will they be able to easily acquire it, or is it something that just is rampant through my family? They did those tests, and then this last test that they asked me about, confirming that, the percentage chance of if I could get breast cancer again. The first time they inquired about it, I absolutely could not do it because I had just paid 20% closing for my home, and I just couldn't visually see coming out of pocket. Well, what they told me even at that time, they was like, well, your insurance will pay for a percentage of it, and we can check your income to see if you fit where we can, do assistance. And my question was, can they go ahead and check my income first? Not thinking that it was going to be approved, but, why not? So I didn't do the testing. Fast forward to last year, they came back and they asked me about the testing again. And I was like, well, yeah. And they said, well, Miss Joe, you're coming up on 5 years of taking tamoxifen. If you don't have to take it any further, it would be great. And the reason why I agreed to go ahead and do it was these reasons. When you take tamoxifen, it affects everything. It can affect so many things in your body. It can, if you had a uterus, it could affect that. It can affect your eyesight. It can affect blood pressure. It can affect all these other things. So I had told them, yeah, go ahead and take the test. Was I approved for additional assistance? No. Did my insurance help pay for it? Yes. Did the majority of the payment come out of my pocket? Absolutely. So the ratio was, the testing of the tumor and tissue was about $5,000. My insurance paid $1,500. I paid the rest out of pocket. But it was approved, it was determined that I had a 0.3% chance that I would get breast cancer again. And since there's a 0.3% chance that I will get breast cancer again, I am now on my last 3 months of tamoxifen, meaning after September, I will no longer have to take tamoxifen again. I thought that this was actually going to end in May. But my calculations was wrong, which it happened. So this bottle is one of 3 bottles, because each bottle holds 30 days of pills in it. It's one of 3 bottles that I will have to consume over the next 3 months, which I'm extremely happy about. Yeah, I couldn't be happier. I'm so ready to not have to take medication daily, right? So here's the thing. I think that the premise of this discussion, or this girl talk, was to try to eliminate some of the assumptions or misunderstandings around how cancer can affect the body, how medications can affect the body, and how insurance, if you have it, come into play. How much you'll have to spend out of pocket. I wanted to try to help people understand, how things added up for me. Now, when it comes to the possible effects of the tamoxifen, I haven't had any negative effects of it. I don't have a uterus. Haven't had a uterus since I was in my early 30s. My eyesight has always been an eyesight thing. So I've been wearing glasses or contacts since I was in school. So to be honest with you, unless I had cataracts today, I wouldn't know one way or another if the tamoxifen has affected it. My eyes tend to fluctuate anyway. Sometimes they work very well, sometimes they don't. I've been having the same eyeglass prescription for 3 years now. What does adjust is my contact prescription, so it tends to adjust often. My high blood pressure, I've never been on any high blood pressure medication. But again, the only time my blood pressure was in any question was when I was going through the mess that I was going through with my ex. So tamoxifen has not affected me in any way whatsoever. So that being said, some of you may be questioning, well, why did you not have a uterus in your early, what happened that your uterus was removed in your early 30s? So when I was in my late 20s, I was diagnosed with fibroid tumors. And what most people don't know, again, is fibroid tumors is very predominant in women of color who, in their childbearing years, right? I don't know if statistics really show that it's based off the trauma of the uterus or not. haven't dug that deep. In my mind, I believe it is based off the trauma of the uterus, and that's why you get fibroid tumors. But again, that's in my mind. But I do know for sure that it is, it affects most women of color in their childbearing age. So I had my first child at 17. I was diagnosed with fibroid tumors, I want to say at the age of 28. And when I was first diagnosed with it, it was, my menstrual cramps was excruciating. My menstrual was extremely heavy. And at that time, my OBGYN, my gynecologist, decided to give me shots. So back in that day, and I don't know if depots are still a thing for women who want to, as birth control. I don't know if Depo-Provera is still used for birth control. But for me, my oncologist decided to give me Depo-Provera to help shrink the fibroid tumors in my uterus. It worked for a while, so it's not a fix. It's a interim solution to try to help you get your anemia under control, because as women, when you're going through menstruals and all this kind of things, likely you are anemic. And if you have fibroid tumors, or if you have menstruals that are extremely heavy, anemia is a severity when it comes to you. So for me, my anemia was so crucial that my skin had no color to it. Like, I was literally looking great. Like, literally, my mom has pictures to show it. Additionally, I was much more petite than what I am now. I may have been like 120 pounds back then. Like, I was pretty small, look much more fit and everything. So I was on Depo-Provera to shrinking my fibroid tumors, to ensure that, to kind of rebuild my blood, right? To cut the anemia out. So I was on Depo for maybe a year. Well, they found out after that year or so, or whatever, that it was no longer working for me. It just wasn't working for me. And the scary part about it is that it ended up where my menstruals at that time was 3 weeks out of a month. So most people who are normal menstrual may last 4 to 5 days. My menstrual was lasting 3 weeks out of a month. So I may have had 5 days off. The scary part about it is that it would just show up. So when you have fibroid tumors, your menstruals are extremely heavy. You're constantly discharging blood clots. Your body is extremely weak because you're losing a significant amount of blood out of your system. When they decided that we need to go ahead and do surgery on you, the tumor in my body, my fibroid tumor, was the size of a small grapefruit. Right? My stomach looked like I was at least 4 or 5 months pregnant. And they gave me an option to have a full hysterectomy or have a partial hysterectomy. The benefits of having a partial hysterectomy is to not have any hormone replacement. I wanted to still feel like a woman. I didn't want to have to take no medications at that time to make me feel like a woman. So for me, I went for the partial hysterectomy, where they removed my uterus. They kept my fallopian tube, so I never had to take any hormone replacement or anything like that. If I had went the other route, I would be taking hormone replacement for the rest of my life. So yeah, I want to say I was 33, 34 when I had that surgery, and I haven't had, issues since. Can't have issues. That's one of the reasons why the side effects when it comes to tamoxifen did not affect me. Like, I don't have a uterus, and it's all good. I think that's another myth that people put out there, is that the fibroid tumors are cancerous. Most cases they are not. Most cases they are not. Mine weren't. So I don't think the fibroids and the breast cancer were related in any way. But I will say that stress wasn't a cause for my fibroid tumors, anything like that, right? I feel like it's uterus trauma that caused it. But stress is definitely one of the number one causes of cancer in someone's body. And that's why it's imperative that we have the right people around us. It's imperative that we take care of ourselves, that we try to maintain a healthy lifestyle, create boundaries, and all those good things. So I just wanted to hop on and share with you guys my story of breast cancer, my story of fibroid tumors. As always, like, comment, or share. And if you have any follow-up questions, feel free to ask. Thank you.